It's truly exciting to be with you here today. After over 125 volunteer hours that we've invested in this project over the course of 20 months, to bring you a tool that I think you're going to find very valuable called We Care.
Some of the most impactful feedback we received from nurses in the field is that they need something that's concrete, that they can use, that they can take away and bring right into the hospital room with their patients. They need something that's concise, that'll meet their requirements for human trafficking education that's required by many states. So we started thinking about, well, what can we do? And we decided that maybe an education piece, maybe getting another opportunity to educate my peers in a way that they can relate to, because it's coming from a nurse. And as a nurse, you know what you need and you can translate that into what your colleagues need. So I approached my supervisors, my director at Lee Health, and she welcomed it with open arms. She said, I think that's great. So that started the journey.
I had to step back and process. The timing of it all was critically important to me. I wanted to process the concept. I wanted to start getting out in the community and meeting with agencies and organizations that were already working on the front lines to make sure that we weren't reproducing anything, but there really was a need for something such as We Care. Based on those conversations I had with agencies and organizations in the community, it did confirm that a type of training written for nurses by nurses would be incredibly valuable to identify, treat, and report for victims of human trafficking in the healthcare setting. In the fall of 2016, a student from FGCU reached out to me that was a member of the Student Nurses Association and asked if there might be an opportunity for her and the Student Nurses Association to volunteer with Christy's cause. And although they were thinking maybe they would do some community service hours, I pitched a rather large idea to them. I asked them, would they be interested in collaborating with us to write and develop a training piece to identify, treat, and report victims of human trafficking at Lee Health.
When I was in nursing school at Florida Gulf Coast University, I was involved with the Nursing Student Association and I held the position of first vice president. So essentially I was in charge of community outreach. I was at home watching TV and I saw a very powerful ad for Christy's cause. So I decided that that would be a really good opportunity for the nursing students to get involved with something local. I had emailed Christy about getting involved, just maybe doing some community service hours or if she had any events coming up that she needed help with. And she asked me if I'd be able to meet because she had a very unique opportunity. She pitched this idea to me about developing a training for nurses by nurses for human trafficking. I was very overwhelmed by the idea at first, but then I decided that it was a really good thing to be involved with, and what a great way to start our nursing careers out by being involved with a training this powerful. So after my meeting with Christy, I brought the idea back to a few friends of mine on the Nursing Student Association board, and they were all just as excited as me to get involved with the training.
Alyssa came to me and other students in the Nursing Student Association, Kristen and Max, and she brought us this great idea that Christy had told her about human trafficking victims and creating a policy and education to identify these victims. And we already knew that we wanted to be on board and we wanted to be a part of this and something bigger than ourselves.
I've been on the social work faculty at Florida Gulf Coast University for 18 years, and I'm the co-founder of the Human Trafficking Resource Center at Florida Gulf Coast University. I've been involved in human trafficking since 2008 when I was brought in as a researcher for a Department of Justice grant through the Lee County Sheriff's Department. Christy Ivie approached me when this idea first came up because of our involvement together with the Human Trafficking Resource Center and asked if I would help on the educational component of We Care. When we first started talking about it, one of the things I knew from the Human Trafficking Resource Center is that Barb Kenny at Lee Health had already developed a policy, which was unusual because most hospitals at that time did not have a policy on human trafficking. So we decided to first, before we started looking at educational models, look at Lee Health's policy. And we were very fortunate because the timing of this, enough time had passed that it was actually up for revision. So that it gave us a chance to work directly with Lee Health on revising their policy before we even started looking at what the content would be for the nurses.
Lee Health was amazing and so supportive. They opened their arms to our policy revisions, and in January 2018 we were able to roll out 2 brand new policies, completely revised, one for minor and vulnerable adult and a second one for focusing just on adults. These updated policies gave us the ability to collaborate with so many different departments: obstetrics, pediatrics, care management, social services, and this collaboration is what gave us the ability to begin to develop We Care.
At this point, things were really beginning to pick up momentum and get exciting. One of the students at FGCU and the Student Nurses Association came to me and said that one of her professors, Dr. Susan Young, had written her doctoral dissertation on human trafficking and was interested in the project that we were developing. So of course, I reached out to Dr. Susan Young, set up a wonderful lunch, and realized that she would definitely be an asset to us developing this very vital training piece.
So being a nursing professor, I felt it was important to introduce my students to the subject of human trafficking, because nurses often encounter victims and they're not aware of what to do or how to proceed. So I did incorporate a lecture on human trafficking with my students. And afterwards, some of the board members from the Nursing Student Association approached me and said that they were working with Christy's cause. And I had been involved with anti-trafficking efforts in North Carolina prior to moving to Florida. So I was thrilled to be able to find out about a local organization and a movement that was already in place that I could join. So I met with Christy in spring of 2017, and we talked about what I could possibly bring to the project. So I had experience writing policies and procedures as a clinic director, and I had done some research on human trafficking. So I was thrilled to join the project, and it's been a really great experience.
We all had our own roles in research projects that we brought back to the meetings. And it was just really exciting to watch an idea and a thought become a reality.
Since then, I've graduated from Florida Gulf Coast University along with my other classmates, and we're now working at other hospitals across the country, and we feel really great because we're able to take this education and this initiative and help victims of human trafficking.
I think each team member would agree that this has definitely been a journey for us, and we've learned so much through it. At one stage in developing the training initiative, we realized that we also wanted to pull in the state attorney's office, because not only did we want to identify, treat, and report, but we definitely wanted to increase convictions. So that was an amazing conversation that we were able to have with Francine Donaromo, who joined our team and actually helped us to develop the documentation piece of the training initiative. We Care was birthed from nurses who genuinely care about victims of human trafficking, who want to identify and treat them in the healthcare setting and give them the resources they need to break free from their captors.